Imagine you are sitting in a clinic waiting room. You are not seriously ill, but you do not feel well. Your name is called, and suddenly you need to explain everything in English. That moment can feel stressful, even when your English is usually fine. Today, we are going to make that situation feel much more comfortable. We will follow a complete doctor visit from check-in to the end. You do not need to memorize every sentence. Just listen and notice the phrases that appear again and again. Let us start at the front desk. You walk in and say that you have an appointment. The receptionist may ask for your name and date of birth. You might hear, "What is your date of birth?" You simply give the month, day, and year. The receptionist may also ask for your health card. You hand it over and wait while they check your information. They might say, "Please have a seat and someone will call you shortly." That means you can sit down and wait for your name. A few minutes later, a nurse calls you in. The nurse may begin with a simple question. "What brings you in today?" This is one of the most common questions you will hear at a clinic. It means, "What problem are you here for today?" You do not need a long answer. You can say that you have had a sore throat and a cough. You can say that you have been feeling tired for a few days. You can also explain that you have had a headache since yesterday. The nurse may ask when the symptoms started. You might hear, "When did this start?" Or they may ask, "How long have you been feeling this way?" You can answer with the simple time expression, "It started 2 days ago. I have been feeling like this since Friday. I have had this cough for about a week." Next, the nurse may ask whether you have a fever. They may ask, "Have you had a fever?" You can say yes, no, or that you are not sure. If you checked your temperature at home, you can tell them the number. The nurse may check your temperature, blood pressure, and heart rate. Then the doctor comes into the room. The doctor will usually ask you to describe what has been happening. You may hear, "Tell me what is going on." This is another way of asking you to explain your symptoms. Try to describe the main problem first. For example, your throat hurts and it is painful to swallow. Maybe your nose is blocked and you have been coughing at night. Maybe you feel dizzy when you stand up. You do not need perfect medical vocabulary. Simple everyday English is often enough. The doctor may ask where the pain is. They might say, "Where exactly does it hurt?" You can point and say that it hurts here. They may ask how bad the pain is. You might hear, on a scale from 1 to 10, "How bad is the pain?" You can give a number that feels right to you. The doctor may also ask whether the pain is constant or comes and goes. If it is there all the time, you can say it is constant. If it appears and disappears, you can say comes and goes. Another common question is whether anything makes it better or worse. You may hear, "Does anything make it worse?" You can say that it gets worse at night. You can say that drinking warm water helps a little. The doctor may ask about other symptoms too. Do you have any nausea? Have you been vomiting? Do you have any trouble breathing? Answer clearly and do not worry about sounding perfect. Your goal is to give useful information. The doctor may also ask about allergies. You might hear, "Are you allergic to any medications?" If you have no known allergies, you can say that you do not have any that you know of. If you do have an allergy, say the name clearly. The doctor may ask whether you are taking any medications right now. You can mention any medicine you take regularly. After asking questions, the doctor may do a simple examination. They may ask you to open your mouth and say, "Ah." They may listen to your chest and back. They may ask you to take a deep breath. Then the doctor explains what they think is going on. They might say that it looks like a viral infection. They might say that they want to do a test to be sure. They may recommend rest, fluids, or over-the-counter medicine. If they prescribe medication, listen for how often you should take it. You can ask, "How often should I take this?" You can also ask whether you should take it with food. Before you leave, make sure you understand what to do next. You can ask, "When should I come back if I do not feel better?" You can also ask what symptoms would mean that you need urgent care. Then you thank the doctor and leave the room. If you have a prescription, your next stop may be the pharmacy. At the pharmacy, they may ask for your name and health information. They may tell you when the prescription will be ready. When you pick it up, the pharmacist may explain how to take the medicine. Listen for how many times a day and how many days you should take it. If anything is unclear, ask them to repeat it. You can say, "Could you explain that one more time?" That is completely normal, even for native speakers. Now think back to the whole visit. You checked in, explained your symptoms, answered questions, and understood the next steps. None of those conversations required complicated English. They mostly used short, common phrases that appear again and again. The more often you hear them, the less stressful they will feel. If you ever hear these phrases in a clinic, Some of them may already sound familiar, and that is exactly what listening practice is supposed to do. You do not have to memorize English first. Let your ears become familiar with it first. If you found this helpful, come back anytime and listen again. The more familiar these phrases become, the easier real conversations will feel. If you would like more real-life English like this, stick around and subscribe. See you in the next episode.